Good morning, everybody. Vince here, and this is going to be a little bit longer of a video. There's more information to cover, but it's an important video. So I want to talk a little bit about my weekend. First, it's good to be back. I had to take some time off away from social media to recharge my batteries. We had a tragedy in the family, and so, it's good to be back. Thanks for who's ever watching. I don't have any notes popping up here to see who's watching. But over the weekend, I had 3 conversations with different therapists after I posted the video with Rob Vining about the skilled nursing facility changes, and it's important. So let's talk about this real quick. So people were being laid off, and this is happening in skilled nursing facilities because of the changes that have happened to Medicare. There's a couple of things here that are surprising for me. One is people didn't see this coming. So if you know that patients are not going to get reimbursed based off of the total number of minutes that they're in therapy, and you know that they have added essentially group therapy so you can see up to 6 patients in one session, the minutes aren't there. And if the minutes aren't there, where did they go? It's funny because my daughter was a kid. There's a video floating around on Facebook, right? I mean, it's funny for me, right? Not for the people who lost their jobs. But she's playing with my daughter at the time, newborn, and she goes, abracadabra, and she literally takes her hand and puts it behind her back. Gone. And so where did those hours go that were in the skilled nursing facility? Gone, right? And so we're seeing people who went from making $90,000 a year, $100,000 a year, $110,000 a year to unemployment. That's scary. If you're a student and you're watching this, is this really the profession that you wanted to go into? If you're not a student yet, really evaluate this profession and figure out if this is where you want to be, because it is a scary time in healthcare. What's going on, Tony? I love everything you're putting out there. It's a scary time to be in healthcare. For anyone who doesn't think that this affects you, your head is in the sand. And I'm going to cover why I think this affects every single one of us, including me. And I'm a contract employee, right? I have my own company and I'm contracted out. But this is going to affect me also in the long run. You better love your job, right? We're going to start there. You better love your job. And so I've been doing this now as a 1099 for a little bit over 2 years. In 2 years, I've taken 4 days off. 3 for the birth of my son and 1 for a funeral, right? But I love every minute that I'm working. I love my job. And so for me, this is setting me apart, and it's pushing me to the top of the heap. I really hope you love your job. Next, we are seeing unemployment from skilled nursing facilities. There's a major change coming to home health starting January 1st. If you're unaware of the change, please take your head out of the sand, because it's coming. And if you don't know it's coming, go look it up. PTs will not be needed as much. It's already been written out there in a couple of the articles. We won't need as many PTs because we're not getting reimbursed as well for PT. We're not getting reimbursed for PT. We're going to be getting reimbursed for the whole case, essentially. And PTAs, that's going to be their safe haven, because the cost of service is low for a PTA compared to a PT. It's roughly 20% less to offer the service through a PTA than through a PT. If you're a PT and you're in home health right now and you notice that you're doing a lot of treatment visits and not a lot of evals, self-reflect. Is this really where you want to be? Because those hours are going to be cut. They're going to be given to somebody who makes less. So we've already seen unemployment in skilled nursing facilities. We're going to see some hours changed and shuffled in home health. So how does that affect everybody? Well, supply and demand, right? We're going to have more PTs looking for jobs than we've had in the past, which means salaries have absolutely no reason to stay elevated. I was doing a little bit of research for some other reason, but I think when I graduated PT school, there were 203 schools in the country, and now there's over, 233. We know that since I've graduated PT school like 12 years ago, the average class size has increased. We're pumping out more PTs than we've ever done in the past. We're seeing PTs being laid off of their jobs. Is this really the profession you want to be in? If yes, we have to do some reflection, okay? And so I have 2 challenges for you. One, if you have your job, why should I keep you? Right? If as an employee, if you have a job, why should I keep you? Because there's an abundance of PTs that are going to be looking for jobs. Okay. In 1997, the Balanced Budget Act came out, and I know many PTs that are great PTs and some that own their own companies now that were unemployed for 6 to 8 months. You know, I've heard the stories. I've talked to these people. We're running into that right now with the changes that are happening in Medicare. And so if you're a PT and you have a job, what makes your job stable? What are you doing to put yourself at the top of the list and not be replaced by a young gunner who's coming out of PT school who wants more? Right? So make sure that you're setting yourself apart from everybody else. And it's really important right now to build your brand, because as an employee, your job is not stable. As an employer, it's a little harder to make money, right? Especially if you're in home health and skilled nursing facilities. But it's going to be a little bit harder to make money. We already know the PTA changes are coming, right? That's about 1.25 years off. We know the PTA changes are coming. And if you're not preparing for it, if you're not thinking about it as a PTA, let me just throw it out there for you. In one company, the PTs will actually be more profitable than the PTA for every patient that is seen with Medicare. So understand that it actually becomes more profitable for a PT to see the Medicare patient than the PTA. Now, with that being said, it's also more costly to have the PT. And so if it's a smaller clinic and the clinic is not busy, it still may be reasonable to have the PTA on staff. But if you're a bigger company and you know you're always busy, why would a company hire the PTA over the PT? The PTA better be a rock star, right? Get good outcomes. Patients better love that PTA. And the same thing holds true for a PT. Why would the company put money into you as a PT if there may be something better out there and they can get it cheaper now because the supply is going up? So make sure that you're paying attention to this. So 2 challenges right now. One, it frustrated me that people were surprised that they were laid off. Because this is something that's been talked about. And if you were surprised, it means that you didn't actually understand what's happening within your own job, right? And so you allowed your employer to educate you on what's happening instead of taking the onus of responsibility onto yourself and going out there and learning about the challenges that are coming with these insurance changes. Same thing's going to happen in home health starting January 1st. My wife and I had long conversations about this last night. So same thing's coming to home health. So challenge number 1, get out there and educate yourself about who's paying you, what changes are they making, and how stable is your job actually. Challenge number 2, build your brand. Because when you're laid off, if you have done absolutely nothing over the course of your career to build your brand, you are not as hireable as somebody else who's put the work in, right? And I tell that to students when they're in PT school. Start putting the work in now. Take 15, 20 minutes a day and build a blog. Start doing vlogs. Start talking about your experience in your profession and how you're building yourself up to be a better you tomorrow. So people are going to look at that. Employers are going to look at that. And if you're not building your brand and you're not making yourself better on a daily basis and demonstrating why you're better and how you're going to bring in more patients, why should we hire you over somebody else? I really hope that this shock, which was a shock, but I really do hope that this shock wakes our profession up to say, right now, a lot of us are at the mercy of the insurance companies and many of us do not understand insurance. You guys have a good day.